Hello, everyone. Welcome. We're so excited to have everyone here. Our webinar season runs September to June, so this is our grand finale for the webinar season. So it's so fun that it's Victor Chirone because he is one of our directors at Canadians for Homeopathy. So we're having a homegrown finale here this year. So last webinar until September, and a wonderful topic, an incredibly relevant and timely topic, and one that seems to be on a lot of people's minds and a lot of people's um, sort of people talk about a lot. So this is going to be fabulous. I still see the numbers kind of pouring in, so I just want to make sure people have a chance to arrive before we dig in. But I'll start by just saying a giant welcome to webinars by Canadians for Homeopathy. My name is Erin Ellis, and I am also one of the directors at Canadians for Homeopathy. And it is my absolute pleasure to be your host, your moderator, your not quite MC, but whatever we want to call me for tonight. I will be here in the background if you have questions or anything like that. We at Canadians for Homeopathy have four pillars that we really focus on: to educate, to communicate, to advocate, and to celebrate everything homeopathy in Canada. And you can find us at canadiansforhomeopathy.com. And our email is learn@canadiansforhomeopathy.com. So if you need to get a hold of us, you know where to go. And our mission is to educate Canadians about the value and appropriate use of homeopathy for the improvement of their health and well-being. Our vision is bringing the health benefits of homeopathy to all Canadians. We want everyone to know about it. And our values are personalized, ethical, quality care supported by competent professionals and freedom of choice in healthcare. And tonight, our webinar is Lyme disease, hidden infections, chronic symptoms, and holistic solutions with Victor Chirone. As I said, he's one of the directors at Canadians for Homeopathy, and a friend, and a font of knowledge on the Canadian homeopathy scene. Victor's a registered homeopath and clinical herbalist. He works out of Manitoulin Island, Ontario. He practices homeopathy and herbal medicine because of the immense transformative powers that both of these modalities have, both on individual and collective levels of experience. Victor values direct experience, careful and attentive observation, and strives to engage with his patients in a way that is authentic and deeply healing. And I think you'll find out tonight that Victor is very authentic. It's a wonderful presentation every time he's here. Victor also employs a range of medicines in his practice to suit the needs of individuals on their individual journey towards wholeness. He practices homeopathy, herbal medicine, and also has an extensive background in Jungian and archetypal psychology, psychoanalysis, anthroposophy, esoteric and symbolic dimensions of the healing arts, and more. So we will be putting his website up in the chat for you to go and check out his website and his offerings if you like. So welcome, Victor. We're so happy you're here giving this talk. I'm going to pass it over to you shortly, but I'm just going to say again a big welcome. We're glad you've joined us. This webinar is to educate about homeopathy and is not intended to be used in place of consultation with a medical professional. Should you experience ongoing or serious health issues, please contact your healthcare professional. And thank you so much for joining us. I am going to swap over to you there. And while you're getting organized there, Victor, I'm just going to let everyone know that Victor has graciously agreed to stay for a Q&A at the end. I'm sure there'll be loads of questions for him. So the chat gets quite lively and full. So it is hard for us to keep track of questions for Victor in the chat. If you could put them in the Q&A section, that would be wonderful. We hope to get to them. We may not get to them all, but if you put them in the Q&A, we'll be sure to see them anyway. Yes, and I see some people, Australia, Reno, Nevada. We've got people from all over. I'm in Saskatchewan, where it's poured buckets twice already today. Victor, you're in Ontario, on Manitoulin Island. Let us know where you're from, how you know about Canadians for Homeopathy, whatever you like. The chat is to create that community, and we love it. So yeah, and then questions in the Q&A. Thanks so much for being here, everyone. Victor, thank you so much, and I'm going to let you take it away.
Okay. Thank you, Aaron, for the introduction. And thank you, everybody, for being here. So we have a lot to cover tonight. And what we're going to start with is a overview of Lyme disease. And because if we don't understand what it is that we're trying to treat, if we have misconceptions about Lyme disease, then it makes our situation much more complicated. And so by developing an understanding of the disease and what's called Lyme disease, we are better able to recognize it when it's there, and we're better able to treat it. With that said, I want to start with a few quotes. Nothing about Lyme disease is simple. And we will see this, I think, very clearly tonight. And secondly, there is no one size fits all treatment for Lyme or any of its co-infections. So there are remedies that can be very helpful and very useful in Lyme disease, but there is no universal treatment strategy, no universal approach. And so it's about understanding the nuances and actually the sophistication of this disease that will lead us to the place where we can begin to understand how to work with it and also begin to understand how to move beyond the automatic fear response that comes up when we hear the word or if we happen to have the condition ourselves. So this is Stephen Buhner, and I wanted to start with talking just briefly about him because a lot of the material in tonight's webinar is from Stephen Buhner. He wrote a book called Healing Lyme, and he was an absolutely incredible herbalist and great author. And this is a pioneering work in understanding Lyme disease. Now, there's really no homeopathic information here in Stephen's book, but in terms of developing an understanding of what Lyme disease is, and how to go about actually recognizing it and understanding its complexity, I don't think there are any better books than this one. So um, he passed away a couple years ago, unfortunately, but he left a great legacy behind and gave us tremendous resources for understanding Lyme disease. So I recommend very strongly that if you want to look at this uh, condition further and really understand it in a lot of detail, then definitely get this book and read other material by Stephen Buhner because he's really one of the great minds when it came to developing a complex understanding of what Lyme disease is. So this is a quote from Dr. Neil Nathan, and I wanted to share this because it is, I think, very important. He said, "We could not deny that many of our patients did not get better." And he's talking about when Lyme disease was basically approached like other bacterial infections and treated with large doses of antibiotics. And the assumption here was that Lyme disease is caused by Borrelia burgdorferi, which is the spirochete bacteria that is mostly known and mostly associated with the disease that we call Lyme disease. But what happened is that when they took this approach of using large dose antibiotics, in fact, many patients got worse. So we had to go back to the drawing board. We realized that tick bites or mosquito or flea bites were essentially injecting not only Borrelia, but also its close friends, Bartonella, Babesia, Ehrlichia, Mycoplasma, and later realized that by weakening our patient's immune system, it allowed all kinds of dormant microbes like chlamydia and rickettsia to flourish, creating an infectious mess. So there's a few things here, and we'll unpack many nuances in this quote. But first of all, Lyme disease is not just Borrelia bacteria. And second of all, even if Borrelia bacteria is involved, going about it by mega doses of antibiotics may help some patients, but many patients it will not help and actually will make the situation worse. So it's important to keep in mind and important to keep in mind that we're dealing with very sophisticated and very intelligent organisms when we're speaking about Lyme disease. And they will adapt and they have adapted and they will continue to adapt to antibiotics. And antibiotic resistance is a major problem, not only when it comes to thinking about Lyme, but when it comes to thinking about this age of superbugs and chronic infection that we are navigating in a myriad of different ways in today's world. And also, and we'll talk about this further, but you note that he says we realize that tick bites or mosquito or flea bites, so ticks are not the only way that you can contract Lyme disease. Okay, that's one huge misconception, and we will explore that further. But very important quote, and already we see that when we move beyond the lens of thinking, oh, Lyme disease equals infection with Borrelia that comes from a tick, it's way too simplistic, and we will get lost if we stick to that kind of reductionistic type of thinking. So the aim of this webinar is not to induce any fear. So I don't want any of you to stop going for walks in the forest or enjoying nature. That would be antithetical to what I'm trying to accomplish here. But as Buhner eloquently states at the beginning of his book, once someone understands what the bacteria do in the body, it tends to lessen the fear that these diseases engender. Understanding what the organisms do during infection also makes it easier to understand the treatment regimens. So we have to really begin to understand what is actually going on. And when we understand what's going on, we can understand how to successfully treat these conditions, but also it lessens this innate fear response. And that is very important because if we stay stuck in that innate fear response around Lyme disease or any other disease, actually, then the chances of us getting better are much lower. So the biggest misconception about Lyme, in my opinion, is thinking that it is merely an infection to eradicate rather than a complex ecological relationship that exists between pathogens, bodily tissues, immune signaling, and the host terrain. So Lyme is not just an infection. It involves very highly complex interactions between infective agents, individual immune and tissue ecology, adaptive microbial intelligence, and much more. So understanding is crucial for both patients and practitioners. We're emerging out of an era that saw actually the wide-scale dismissal of Lyme disease by the allopathic medical establishment. For many years, doctors thought that Lyme disease was non-existent. And there are some who still believe this. There are some who still believe that if you just take a course of antibiotics that you'll be cured. So the mainstream medical establishment is way behind in terms of understanding Lyme disease. Testing is very, very, very poor. There's many problems, and we'll discuss all of this in much more detail. But so we have faulty and unreliable tests, but we also have willfully ignorant physicians who don't take patient experience seriously and also don't know or don't want to dive into the complexities of listening to their patients enough that they can begin to understand what's actually going on. So here's another quote from Buhner. For an extremely long period of time, the Centers for Disease Control and Prevention, the CDC, in the United States refused to acknowledge how widespread and common Lyme infections were. In 2004, they insisted that there were only 20,000 infections that occurred yearly and that such infections were geographically limited, that is to say, happening in specific regions or places. Both of those, the number is way off, and the geographical limitation is total fabrication. This led many physicians to then dismiss their patients' requests for Lyme testing and to insist that many patients that they were seeing with neurocognitive damage could not possibly have Lyme, a co-infection or Lyme chronic disease condition. So a great many of off-the-cuff diagnoses were made, often attributing the symptoms they were seeing to multiple sclerosis, Alzheimer's disease, or psychiatric problems. And this is very sad, and it is still happening. But many people are basically treated very egregiously and are put in psychiatric wards because of neuropsychiatric symptoms that are associated with Lyme disease. And they're not really psychiatric patients, they're chronic Lyme sufferers. So, there are huge abuses that are actually taking place in the Lyme community. And there are people who are suffering from psychiatric conditions who may actually have some form of Lyme, and it hasn't been actually diagnosed or recognized properly, and so they're considered an anomaly and basically hospitalized as a psychiatric case, and this is still going on. So it just goes to show that the general state of affairs in terms of understanding Lyme, treating Lyme, we have a lot of work to do in this area. So, um, Lyme is not just simply an infection, right? So there's a lot of talk these days about terrain theory. Some people take it so far as to suggest that there is no such thing. There's no effect, there's no such thing as an infection. I don't personally maintain that belief. I think there are enough very clear cases to show that there is mechanisms of transmission through ticks and through other arthropods. Also, from human to human contact is transmission is very real, so, and we'll talk about that further. But it's not one or the other. Yeah, it's not either or. It's both the microbe and the terrain. So the microbe is actively participating in altering, shaping, and creating the terrain. Yeah, so it's not one or the other. We have to understand the microbe and the terrain as part of a complex whole. Otherwise, we have a one-sided, distorted, reductionistic view. And yes, terrain theory itself can be reductionistic. So Borrelia doesn't simply infect tissue, and we're not just talking about Borrelia, right? But this is the most common bacteria that's associated with Lyme. So often we might use it as a placeholder. And it is the most common bacteria that is associated with active Lyme infection, but not the only one. And usually it's not there by itself. So Borrelia doesn't simply infect tissue, it actively manipulates immunity to create more permissive environment for itself. And so we can consider some examples of how this might work. So early infection often triggers strong pro-inflammatory cytokines, which lead to fever, aches, and fatigue. And what are cytokines? They're basically signaling proteins, and they play important roles in terms of regulating the immune system, inflammation, and cellular communication. And we'll talk more about cytokines. So we have this early reaction where there's a strong activation of pro-inflammatory cytokines, and then we see fever, aches, fatigue, etc. And then later, Borrelia pushes towards immune suppression and immune exhaustion. So then it starts to exhaust the T helper balance in the body. And the T helper cells are white blood cells that coordinate the entire adaptive immune response. And what happens when there's an alteration of the T helper balance is that there is an increase in regulatory signaling, which means that the Borrelia basically pushes the immune system to produce more of a kind of calm down, don't attack signal, which suppresses the immune response. So the Borrelia bacteria is actively manipulating the immune response, telling it to calm down and don't attack. So it convinces the immune system not to destroy the bacteria. The bacteria itself convinces the immune system not to destroy it. Yeah. So very, very sophisticated and intelligent bacteria that we're dealing with. And what happens when we have this reaction where there's an alteration of the T helper balance, we see reduced pathogen clearance, we see chronic inflammation, we see increased vulnerability to viral infections, and basically the terrain becomes progressively less able to self-regulate. And so we're dealing with a situation where there's chronic dysregulation of the immune response. Um, so the short summary of this is that Borrelia and other related bacteria actively manipulate the immune system by interfering with a myriad of immune responses, which allows it to persist in the host in spite of the body's defense uh, strategies. Basically manipulates the body's defense strategies. So, some major misconceptions about Lyme disease. Lyme disease is just Borrelia bacteria, right? So, a tick bite may transmit Borrelia, Babesia, Bartonella, Anaplasmosis, Ehrlichia, Mycoplasma, different viruses, Rickettsia, and there's a very long list. And all of these organisms are continually evolving, and there's new variants that are continually emerging. And that's not going to stop. It's not going to go away. It's not going to stop. It's just going to become more complex. So we have to maintain that level of complexity in terms of our understanding of this phenomena. So Lyme is often basically a polymicrobial syndrome. So it's very rarely a single organism illness. And so a patient may treat Lyme, say with antibiotics, and the Borrelia may improve, but then Babesia or Bartonella co-infections might start to drive the symptoms. So another misconception is that Lyme disease is basically the same everywhere. Yeah, Lyme disease is a case of Lyme disease, is a case of Lyme disease. No, definitely not. So microbial genomics, which is the study of the complete genetic material or the genomes of microorganisms such as bacteria, teaches us that Lyme infections are not anywhere close to being biologically identical everywhere. They can be very different in terms of their presentation from one region to the other. And so even if we consider Borrelia, it's crucial to understand that different strains of Borrelia bacteria can differ quite significantly, even in terms of how they're affecting patients. So another quote from Buhner, the recent history of Lyme Borrelia organisms, as the researchers have commented, appears to have been genetically turbulent, revealing that the bacteria and their plasmids are currently in a state of rapid evolutionary change. Like many pathogenic bacteria, the spirochetes that cause Borrelia are Borreliosis is the technical name for what we might call some forms of Lyme disease, are feeling tremendous environmental pressure from the massive environmental alterations and antibiotic usage that currently accompany human civilization. They are altering themselves very quickly in response to those pressures, and the human species is feeling the impact. So, overuse of antibiotics for many decades now, and significant ecological perturbations that are taking place all over the world are two major factors that are fueling the basically rapid mutations of Borrelia and other kinds of bacteria, other pathogenic organisms. And we'll talk about the significance of this and some of the things that are useful to think about in this respect. Okay, another misconception, the only way to contract Lyme is through a tick. Definitely not. So Lyme disease is believed to be spread by ticks alone. The main reservoirs for the disease are considered to be mice and deer. Right? The ticks are feeding on the mice and deer, and they serve as reservoirs or vectors. And that the disease is considered to be geographically limited. So this is totally wrong. Every aspect of this is wrong. And so while transmission from ticks is probably the main route of human infection, there has actually been very little research concerning other routes of transmission that have been confirmed. So Borrelia spirochetes are present in many other biting arthropods, mosquitoes, mites, fleas, biting flies. And so this is documented as being viable routes of transmission of Borrelia. Relevant too is the presence of co-infectious microorganisms, which we've discussed, that other biting insects will carry. And then also human-to-human transmission. So sexual transmission, for example, has been documented, is a great deal more than physicians realize. So Borrelia spirochetes nearly immediately colonize the urinary bladder of all infected animals, irrespective of the species. They like to hang out there. So they are then expressed out of the body in urine. So chlamydia bacteria also do this. And so there is a connection between Lyme disease and chlamydia. And we can perhaps discuss that a bit further. Another misconception. Lyme is primarily a bacterial load problem. So that's partially true, but remove the word primarily because it's not primarily that. It's equally a consequence of cytokine dysregulation. We talked about cytokines before, right? They're basically small signaling proteins that are produced by various cells in the body, especially immune cells, and they help to regulate immune responses. They modulate inflammation, and they play important roles in terms of cell communication, and they direct the activity of immune cells to fight infections and maintain homeostasis. So when the cytokines are dysregulated, then there's no homeostasis that's taking place, and the immune system it becomes very chaotic. And I think that's a good way to describe what happens when we're talking about Lyme. We also see collagen destruction. We see also endothelial injury. And so, what does that mean? It means injury to the inner lining of the blood vessels, and that triggers inflammation. And then it reduces nitric oxide production and exposes the underlying tissue matrix. And that promotes plaque buildup and clot formation. And that is one of the main causes, endothelial injury of cardiovascular disease. So, that is why many patients with chronic Lyme will start to experience heart issues. And we see immune dysfunction and we see nervous system inflammation. So Lyme disease is not primarily any one of these. It can be all of them combined. So symptoms come less from bacterial quantity and more from what the microbes themselves trigger, how the system is being manipulated by the bacteria. So there might be relatively low pathogen burden in the body, but you can still have very intense, debilitating even pain, panic, neuropathy, brain fog, and many other symptoms, even with a very, very, very low bacterial load. And this is because the inflammatory signaling cascade is dysregulated. And that's basically to say that the inflammatory signaling cascade is an orchestrated biological sequence where immune cells are detecting threats and they release chemical messengers to recruit defenders and clear the damage and initiate tissue repair. And with Lyme disease, those mechanisms are chaotic. They're not functioning properly. And so you have all of these very puzzling symptoms that are happening, very intense symptoms that are happening that it seems like are not going to go away. And sometimes when you give antibiotics and the immune system is already massively dysregulated, the antibiotics are just going to make the situation even more dysregulated. So it's complicated. Okay, this one was another huge misconception, and it's unbelievable to me, but you still see it on the news. oh, if you find a tick and you remove it within 24 hours, then there's nothing to worry about. It's totally false. It's been proven to be false. It's not even up for debate. And yet it's still uh, said everywhere that, oh yeah, if you find the tick on you and you remove it within 24 hours, then you're good. No, definitely not. Transmission of Borrelial organisms occurs with a tick attachment somewhere between 10 minutes and 72 hours. And so you can consult Buhner's book on that. And there are many factors in terms of, um, you know, what will determine the rate of transmission of a disease, including the individual, the terrain, yeah, the innate state of health of the person who has a tick on them, which is one of the most important factors to consider and something that we'll be talking quite a bit about in the slides to come. But there are a few points here. So hard ticks transmit organisms about twice as fast as soft ticks. Partially fed ticks transmit Borrelial organisms more quickly. Ticks co-infected with other transmissible bacteria also have faster transmission times, and the health and weakness of an individual's immune system makes a significant difference when it comes to various aspects of transmission. So all of those things are very important to consider. So don't ever listen to anybody who says that you have to have the tick on for 24 hours, this magic number. Yeah, if it's 23 hours or it's 20, it's ridiculous. It doesn't make any sense. And it completely ignores the complexity of what it is that we're dealing with. The type of tick, what stage in its life cycle it's in, the state of your immune system, all of those are important determinants. Um, okay, here's another misconception that a person has Lyme or they're suffering with chronic Lyme because the immune system is weak. And so the strategy has to be to boost the immune system. It's just not how it works. So in chronic Lyme, immunity is often not weak. It's more appropriate to describe it as chaotic or dysregulated, right? And that's a very important point to remember. I've already said that, but I'm going to emphasize it again and again because it's really important to recognize. So you may see simultaneously overactive inflammatory signaling and underactive pathogen clearance. So in those situations, it's not a question of boosting immunity, but about restoring intelligent immune regulation. And the success of a treatment often could depend on recognizing to learn to work with this fact, recognizing the patterns of immune dysregulation and how to bring it back into homeostasis. Okay, another misconception that bacteria are unintelligent. Yeah, they're just these small little stupid things. Uh, so that's part of the thinking that got us into this mess. Yeah, that we can just give antibiotics out like candy and kill off all kinds of infections and everyone's going to be living in a world of sunshine and rainbows. Well, it doesn't work like that. And even if you read the Nobel Prize speech of the inventor of penicillin, I don't remember his name at the moment, but um, you read his Nobel Prize speech, and the last thing that he says in that speech is penicillin is very powerful. It should not be used unless it is absolutely necessary to do so. Do not start just giving this stuff out because bacteria will very quickly develop resistance and we'll find ourselves in big trouble. And nobody listened to him, and so the rest is history. And that is part of the problem that we're dealing with when it comes to thinking about Lyme. So here is a quote from Wolf Dieter Storl, who is a herbalist who also has a good book on Lyme. It's more, you could say, philosophical in some ways and exploratory than Stephen Buhner's book. They're very good complements to each other. But he's talking about bacteria. So, how do the bacteria manage to become immune to antibiotics? It turns out that if their environment becomes contaminated, they do not simply wait for a chance mutation. Instead, they react with deliberate mutations, allowing them to adapt to the prevailing conditions. American scientists were puzzled when they noticed that bacteria often mutated even before they came into contact with a new antibiotic, as if they had sensed or anticipated it. So, bacteria are developing resistance to antibiotics that they have not even been exposed to. They're anticipating the antibiotics that are being created to try and kill them off. That's how intelligent bacteria are. So it's quite remarkable and really quite mind-blowing when you consider just how sophisticated these organisms are. So in order to deal with this puzzling fact, Rupert Sheldrake has proposed that microbes cannot be understood alone as single organisms, but as part of the greater morphogenetic field of the species. And so this is something to explore. We're not talking so much about morphic resonance in this lecture, but I think it is an important topic. And so there's a good article here by Rupert Sheldrake about morphic resonance, an introduction. You can find that very easily online. And basically, the theory of morphic resonance is the theory of memory in nature and how traits and characteristics and forms of organisms get transmitted from one generation to the next, to the next, to the next, to the next. So morphic fields include all kinds of organizing fields, the organizing fields of animal and human behavior, of social and cultural systems, and of mental activity, all of which can be regarded as morphic fields which contain inherent memory. So when we're talking about bacteria and we're talking about the evolution of diseases and we're talking about the evolution of Lyme disease, we have to start thinking of it in terms of complexity theory and morphic resonance. So Borrelia, just as all other bacterial organisms, is under massive pressure from antibiotics, from shifting climate patterns, altered host migration, urbanization, and habitat destruction, pesticide exposure, changing reservoir species, etc. Also, because evolutionary pressure selects for strains that are better at persistence, stealth, immune modulation, and biofilm formation, among other factors. And microbes are not static. They always are continually adaptive. And here's one example. Changing bird migration patterns can spread strains from across different continents, which means that previously separate Borrelia populations start to intermingle. And this is a pelican. And this pelican was recently spotted where I live on Manitoulin Island. We've never had pelicans so far as I'm aware. And then they started showing up. So it just goes to show that, even the migration patterns of birds and pelicans are one possible vector of ticks that are carrying Lyme disease. The migration patterns of birds can affect the evolutionary trajectory of Borrelial and related organisms. So we're dealing with something very, very, very complex. So uh, when it comes to understanding bacteria and viruses, one of my favorite sources is Lynn Margulis. She was an evolutionary biologist, and there's just two quotes here. Life on Earth is such a good story, you cannot afford to miss the beginning. Beneath our superficial differences, we are all of us walking communities of bacteria. The world shimmers, a pointillist landscape made of tiny living beings. Very, very beautiful. And another one, we can no more be cured of our viruses than we can be relieved of our brain's frontal lobes. We are our viruses. So just some good perspective to keep in mind. And I highly recommend the work of Lynn Margulis if you want to understand bacteria and viruses. There's a lot of misconceptions about bacteria and especially viruses in recent years. So plants and bacteria are very, very important for all of life on Earth. Yeah, they actively maintain the human livable state of the planet. And so one of the last quotes I'm going to share from Buhner, but he says plants as a general group predate us by well over 100 million years. They must have been doing something all that time besides waiting for us to emerge from the ecological background of the planet and suddenly notice they don't care about our rules of behavior. And of course, they have been. They perform many crucially important ecological functions. In fact, they are the second most important group of organisms, the first being bacteria on this planet. Both actively maintain the human livable state of the planet. And so, if we don't understand that bacteria are actively maintaining the livable, human livable state of the planet, then if we don't recognize that to begin with, then our treatment strategies are going to be totally off base. We have to start from recognizing that fact. Okay, and here is just a short uh, visual to help you regulate, come back to yourself. The mandala of evolution, very nice painting. Okay, so now we're going to get into talking about some materia medica and what to do if you find a tick on yourself, because there's a lot of things to do, and definitely what not to do is to freak out. Okay, that's not going to help. It's not going to help you. It's not going to help the people around you. So use a proper tool to remove it. So tweezers are not the best. There are tick removal devices that you can find online, and there's a number of them. I'm not going to endorse any particular ones. There's many good ones, but it should be something that is designed specifically for removing ticks. Okay, prepare a paste made of andrographis tincture mixed with green clay. So Andrographis is a herb, and I'm going to be talking today about herbs and homeopathics because when we're dealing with Lyme disease, we, in my opinion, should be recognizing the importance of using multiple modalities, especially in very complex cases. Especially also if you're bitten by a tick, I'm not just going to rely on one homeopathic remedy. that might work, that might not work. Yeah, it's good to take precautions. So andrographis tincture mixed with green clay, and this paste, if it's applied directly onto the bite, the site of the bite, will significantly help to prevent active infection. It works miraculously well. Many, many, many cases, I would say over 90% of cases can be prevented if you found the tick. If you remove it, you put this paste on, and I would do it for 3 or 4 days. Um, and it is very, very effective. You can also add a few drops of frankincense oil and then apply that. Basically, put the green clay with the andrographis plastered on. You can then put a bandage around it so it stays in place and keep it there, refresh it daily for 3 or 4 days. Um, a herbal recommendation is to start taking astragalus, about 3 grams daily for 30 days, and then 1 gram daily thereafter, basically indefinitely until you feel that you're in the clear. Um, it's not necessarily a herb that every person should be taking, right? So none of this is universal advice. It's things that work for a lot of people. Yeah, but don't take it as universal advice. If you already have chronic Lyme, then astragalus is probably contraindicated because it can cause exacerbations for complex reasons. And I don't know if we'll be able to talk about them, but andrographis is contraindicated in many chronic Lyme cases. So astragalus is excellent at keeping the immune function vital, also if you live in a Lyme endemic area. So if you live where there's lots of ticks and you go out for walks, um, you should probably be taking herbs that are priming your immune system so that if you are bitten by a tick, that your chances of contracting anything are much lower. So astragalus daily during the peak of tick season is really, really good. Other herbs, cordyceps, eleuthero, rhodiola, Scutellaria bicalensis, which is the Chinese skullcap, and Uncaria tomentosa, cat's claw, as well as with Withania somnifera, ashwagandha. These are all really good herbs. Japanese knotweed, which is a herb that we'll talk about, is also really, really good herb to be taking after a tick bite and also preventatively. So here's Andrographis, very interesting herb that has been used for a very long time in Ayurveda. We won't talk about it in length today, but I wanted you to know about the fact that it can be used topically. It's very important. And then astragalus, which is one of the main herbs that are used for prevention and for early treatment to stop things from progressing. So why 30 days of treatment post tick bite? Because Borrelia spirochetes actively peak every month or 28 days. They correspond to a lunar rhythm. So the Borrelia spirochetes are synced up with the cycles of the moon. So here's another actually very beautiful and complex factor when it comes to understanding what it is that we're dealing with. So the duration of the cure should thus be at least 1 month. Um, So 1 month of, yeah, of, you could say a heavier treatment and then gradually decreasing over weeks. That's one strategy that can be quite highly effective depending on what it is that you're dealing with. Okay, lymphatic drainage, not herbs, not homeopathy, but super, super important. If the lymphatic system is not working, then nothing's going to clear from your body. So lymphatic drainage is something that you can be doing by yourself, on yourself every day. I recommend it to a lot of patients, and the results are quite phenomenal. Not only when it comes to working with Lyme disease or other chronic infections, but in general. So what I would recommend is that, if you're concerned about the state of your immune system, or even if you're not, try it out because most people are dealing with lymphatic stagnation. I can say this from my own experience because I didn't think I had any problem with my lymphatic system. I started then experimenting with lymphatic drainage. I like to experiment with different things, and the results were mind-blowing, absolutely mind-blowing. So this is a great resource. Um, Doc Talks Detox on YouTube. She has a lot of free resources. I'm in no way associated with her. She just presents really good free material. Um, and I would look up the specific 7 step-by-step lymphatic drainage tutorial. It's very, very important information. It will revolutionize your state of health. Most of you that are listening, if you try it and you stick with it, it will revolutionize your health. It's really quite remarkable. So why lymphatic system? Why is it important? Lymphatic system is a morphological expression of the life body. or what in anthroposophical medicine is called the etheric body or the etheric organization. And it's that aspect of the human organism that's responsible for growth, regeneration, nourishment, fluid balance, and formative vitality. The lymph is the carrier of the formative life forces. So we can contrast the blood and the lymph, which is often done in anthroposophic medicine. So blood is closely associated with the individual ego activity, with the warmth organism, with consciousness, whereas the lymph is associated with pre-conscious life processes, nutritive, growth-oriented matrix from which tissues are maintained. So if the lymph is not functioning, then we're in trouble, especially if we're dealing with chronic infection. So lymph represents a zone where the body is still becoming rather than existing as already fully formed. The etheric body shapes, regenerates, and maintains the physical body. So if the lymphatic system, if the etheric body is out of order, then it's going to be very difficult for there to be any kind of homeostasis, especially when we're dealing with something like Lyme disease. The etheric body is responsible for processes of growth, healing, regeneration, tissue maintenance, and embryological patterning, which we'll talk about more in a second. And the lymphatic system is seen as one of the clearest physical correlates to etheric activity because weak etheric organization shows as edema. What happens if you have sluggish lymphatic system? Edema, swelling of tissue. Sluggish detoxification, also an indication of faulty lymphatic functioning. Poor wound healing, chronic swelling, low vitality, recurrent infections. All of these things can also be strongly associated with Lyme disease. So lymphatic system is very important to be maintaining. Crucial both for prevention and for treatment. Okay, embryological patterning. Why is that important? So, embryological patterning or embryo pattern formation is the process whereby a single homogeneous cluster of cells develops into an organized three-dimensional organism. So, it's important for us to understand that infection can affect this process quite significantly. So, for example, transmission can occur from mother to fetus. There are many well-documented cases of this. And there can be very significant complications when this happens because the embryological patterning becomes distorted and disturbed. So here's a quote from a book called The Homeopathic Treatment of Lyme Disease. For some time, there have been reports of Lyme infected mothers who pass on to their unborn children certain deformities which resemble those caused by syphilis. And you can see here syphilis on the left and Borrelia on the right. You see how similar the spirochetes are. They're both spirochetes. So same basic group of bacteria. And yes, if a woman is pregnant and she has chronic Lyme, it can cause significant deformities to her baby. This fact alone demonstrates the close similarity between not only the bacteria, that is syphilis and Borrelia, but also the diseases themselves. Lyme and syphilis also share in common the fact that they can present in three consecutive stages with long latency periods in between. And they are also considered, both of these diseases, to be the great imitators. So they can imitate different kinds of diseases and often are misunderstood. Misdiagnoses happen all the time with both of these, with syphilis and with Borrelia and other related groups of infective agents. Okay, so materia medica of Lyme, there's a lot of material. We're just going to kind of scratch the surface today. So the most commonly prescribed remedy for tick bites is Lidum. Personally, I don't think it's the best, but we need to talk about it because it is what most people are recommending. So Lidum is a member of the Ericaceae family of flowering plants. So uh, the family has a lot of important indications for Lyme. Immobility, focus on the joints, rigidity, and resistance to change. So the physical realm expresses as rigidity in the musculoskeletal disorders such as decreased mobility of the limbs, joint pathology, rheumatism, joint weakness, and pains that shoot downward or mitigate laterally. And so joint complications of Lyme disease are very characteristic of this family. So there can be also on the mental emotional level, not only for Lidum, but of of the plants in this family, a certain rigidity also on the psychological level. So obsessive tendencies. So there is a very interesting group anamnesis that was done. So basically collecting the common symptoms of Lyme disease by some homeopaths associated with Jan Scholten in order to identify kind of genus epidemicus remedies. And so we won't go through all these rubrics, but there's a number of different rubrics. And so throat pain, back pain, rheumatic pain, different parts of the body, genitals inflammation, extremities pain, rheumatic, etc., etc. Lots of inflammatory pains of the joints, of the hips, of the knees. You can see all of these in more detail. You can look up this article if you'd like. Neuralgic pains, chest pains, heart issues, inflammation of the heart, as we already talked about. Yeah. Wandering pains, changing pains, rapid change of symptoms, which can also be quite characteristic of Lyme disease. And when all of these symptoms are taken into consideration and you do a repertorization, the two remedies that come up at the top are Calmia and Ledum, both of the Ericaceae, the Heath family. So you can look it up, this article, if you'd like to read more about that approach and understanding why, even from the perspective of rubrics and symptoms, the Ericaceae family is very important to consider. So Luke Klein talks about the Ericaceae family and Ledum, and he basically says that the Ericaceae family is very important in the treatment of Lyme disease. Historically, Ledum was an important remedy for the treatment of symptoms that are very similar to those with this condition, and it is a remedy to consider after a tick bite. However, from his experience, after using Ledum, he was not happy with the results and noticed that other remedies in the same family, such as Calmia and rhododendron, worked much better. Um, these all belong to the Ericaceae or the heather family, as well as being plants that are found where Lyme disease is endemic. And I've emphasized that because we will talk about it. It's very important to recognize that the plants that are growing around an area where Lyme disease is endemic are often medicinal for Lyme. Yeah, so the ecosystem is responding with plants that are useful for treating the bacterial infections that are present in the same area. Yeah, so that's again the importance of thinking in terms of complexity. So Calmia has migratory pains moving from joint to joint, and that's one of the strongest symptoms that we see in Borrelia as well as Lyme disease in general. And Lou Klein gives some short case examples here, which we won't read, but wandering joint pains is very characteristic of Calmia, which is definitely a good remedy to consider after a tick bite. The top remedy in Lou Klein's experience, and also I've seen very good results after a tick bite, is Calluna vulgaris. So it may also be listed as Erica vulgaris. It's Scottish heather. It's the common name. A plant that was sacred to the Druids and one of the plants that was used historically in making inebriating drinks well before the time of the German Purity Act and before hops became the dominant herb that was used in beer making. So it's a very sacred plant. And Luke Klein, I learned of this from Luke Klein, and he considers it to be the top remedy to give after a tick bite. He argues that it should be considered as a genus epidemicus remedy in Lyme. So, Calluna vulgaris, important remedy to know. There's not much information about it. I'll share what we have. There it is. So, Calluna, what we see here is loneliness, which is very interesting because many patients that are dealing with Lyme feel alone. They feel lonely. They feel like nobody understands what they're going through. So it's interesting that that aspect is there in the remedy. They feel stuck in personal problems, which can happen a lot. You feel stuck, no way out, can't move past this. I feel like I'm blocked. I feel like I'm stuck. That's there in the remedy. We see also a hypochondriac tendency, also a tendency for feigning sickness, which is interesting because that is exactly what patients of Lyme disease are accused of. You're just making it up. It's all in your head. So it's very interesting that that's in the remedy too, that patients who need this, say, as a constitutional remedy, will actually be pretending that they're ill when they're not. There can be self-pity, which is also highly characteristic of Lyme, and elements from mental work. And you can see this as well. A lot of Lyme patients will feel a self-pity, and then they try and push themselves and push themselves and push themselves, and it depletes them even more and even more. So that's the mental emotional picture of Cluna, which is very appropriate to consider in light of Lyme disease as a general phenomena. So on the physical level, we see fever, which is obviously an important early symptom of Lyme infection, stomach pain, diarrhea, which we can also see in Lyme, a lot of urinary symptoms. And remember, again, the Borrelia will easily and very quickly um, go to the urinary genital organs, and they like to live there in that environment. So we have a remedy here that also is very specific for the urinary system. and also limb pains, gouty rheumatic issues, and lots of skin issues as well. Um, Herbal repertory from Matthew Wood, we see its affinity for the kidneys, for the bladder and the urethra, for cystitis, for rheumatism, in muscle injuries, painful muscles, inflammation, bruised feeling, and for uric acid buildup. Um, Erica vulgaris or Calluna vulgaris is also well known as a flower remedy, flower essence. I wouldn't use it a flower essence after a tick bite, but there's a lot of information about it um, that you can look into if you're curious about understanding this medicine more. So, some other indications for Kaluna: deep exhaustion with nervous depletion, renal, urinary involvement or irritation, coldness, weakness, collapse states, post-infectious debility, and worn down by prolonged stress or illness. Okay. Um, Here is Kalmia, another important medicine to think of after a tick bite. Remedy of rheumatic pains, paralytic pains, pains and aching in the limbs accompanied by other symptoms. They become rigid and inflexible as a result of the pathology, and pains are alternating sides. So neuralgic pains extending downwards. And again, we see the emotional stiffness, the inflexibility, shunning company, muscular weakness and degeneration, multiple sclerosis or fear of multiple sclerosis, rheumatism. These are some primary indications of calmia. Okay, manganum, very interesting and important remedy to think of in Lyme. Why? So these insights also partially came from Luke Klein, and he suggested that homeopaths start to explore manganum, which is an old remedy, but we have different versions of manganum, manganum aceticum, different salts of manganum. Um, and manganum is related to, ferrum. It's in the ferrum, the iron series of the periodic table. And so it's stage seven of the iron series, and it has the feeling of basically wanting to do more than one can. And so other expressions that you see in manganum is extreme pressure to perform, working despite the pain, forcing function through weakness, endurance under chronic strain, anger at physical limitations, the feeling of I must keep going. There's concern about my contribution, training, working in a team, knowing that I can, but wanting to improve. So all of these are important psychological indications that might point to manganum. We also see in manganum deep bone pain, periosteal pain, joint pain, worse movement and exertion. And those are all characteristic symptoms that you see in many cases of Lyme. Migrating joint pains, bone pains, deep aching, tendon inflammation. And we also see neurological symptoms that are associated with manganum as a remedy in Lyme. Hyperesthesia, which is abnormal increase of sensory stimuli, particularly touch, pain, and temperature. So all of those can become increased in Lyme disease. Manganum has it. Neuralgia, a sharp, shocking pain that follows the path of a nerve, right? And so there can be irritation or damage to the nerve as a result of Borrelia or other bacterial organisms, and a general oversensitivity of the nerves. We can also see burning, buzzing, paresthesias, tingling, numbness, pins and needles feeling, and this can often occur in the extremities, the hands and feet, and also electric pains. All of these can be highly characteristic of Lyme disease and highly characteristic of the remedy manganum or one of its salts. So we have a nice entry from Patak, old Materia Medica, very good Materia Medica. Uh, Manganum is associated with anemia, with destruction of red blood corpuscles. It affects the joints, the ankles, and the lower limbs, motor paralysis, ascending, paralysis agitans. Bones are very sensitive, painful, deep soreness of the whole body. Every part of the body feels sore when touched. Chronic arthritis, in weak joints, progressive muscular atrophy, typhoid fever, which is basically prolonged high fever, fatigue, headache, abdominal pain, diarrhea, or constipation. All of these can be very highly characteristic of Lyme. So the symptom picture from the classic Materia Medica is very fitting. But there's more. Yeah. And this is something that, again, when we start thinking in terms of complexity, we can start to see deeper dimensions of why certain remedies might be useful. So manganum. Um, the connection between manganum and Lyme. So many pathogenic bacteria rely heavily on iron. Borrelia is manganese dependent. Yeah, manganese is manganum. It's the same thing. Okay. So Borrelia rather than iron or Borrelia rather than rather than iron, are highly dependent on manganese. So once acquired, the bacteria then create a manganese superoxide dismutase, an enzyme that protects the pathogens from intracellular superoxides. So what that means is that Borrelia bacteria survive because they hijack manganese from your body and use it to build armor against your immune defenses. So the Borrelia bacteria are basically hijacking your manganese stores and using it to build armor for themselves that protect against your own immune defenses. So manganese, manganum is a crucial element that the Borrelia bacteria are hijacking from your body so that they can survive. So that is another reason why manganum is a very, very important remedy in Lyme disease. Yeah, because the Borrelia bacteria are literally using it all the time. And it's quite an anomaly because most other bacteria are much more heavily iron dependent than they are manganese dependent. So it's very, very interesting. Um, there's a good book here, The Homeopathic Treatment of Lyme Disease. And in this book, the remedy Aurum arsenicosum is discussed. And this author argues that it is a genus epidemicus remedy in Lyme. Personally, I haven't used it for that purpose. He presents an interesting summary of that remedy, approving and cured cases. I'm not going to talk about it because I don't have experience with this remedy in Lyme disease, but I wanted to mention it. It's a good book. Okay, Japanese knotweed. I mentioned it already. Some of you probably know it. It's a very destructive plant that was brought over from Japan as an ornamental. And interestingly, the man who brought Japanese knotweed over from Japan was also the man who introduced vaccination to Japan. Um, Interesting. And what to say about Japanese knotweed? So Japanese knotweed is one of the main herbs and also homeopathic remedies that are used in the treatment of Lyme disease. Can be used both in the herbal form and the homeopathic form. Why is it so important? So, one last quote from Buhner, Polygonum cuspidatum. Um, it moves into new ecoregions, creating unique hybrids that themselves possess unique ecological functions. Uh, Knotweed tends to move into regions about 6 months before Lyme disease becomes endemic there. So it's one of the main medicines used in the treatment of Lyme disease, and it moves into an area about 6 months before ticks that are carrying Lyme show up. The ecosystem is anticipating the emergence of Lyme disease. So talk about intelligence and talk about complexity, right? So Japanese knotweed is not just something to eradicate. It's not evil. Yeah, it causes lots of destruction, but it's there for a reason. Invasive plants are there for a reason. They're not just showing up at random. Yeah, they're showing up because they are trying to repair the ecosystem in which they emerge. Yeah, that's why invasive plants show up. Garlic mustard, another invasive plant, not so much useful in the treatment of Lyme disease, but it actually will actively suppress tick populations. So people going around trying to eradicate garlic mustard. Garlic mustard is there for many functions. One of them is to suppress tick populations. So we have to think beyond, oh, these plants are so damaging. They take over so much area. They destroy foundations of houses. Yes, they do those things, but they're doing much more than most of us want to recognize. We have to let go of our all too human frame of reference and just thinking about things from the perspective of our own convenience. Because when we do, we miss the point. Um, so. This is a ridiculous article. The war on Japanese knotweed. It is so ridiculous. And this is how people are thinking about this plant. Um, so basically, I'll just read this quote because it's like you can't get more absurd. So Bose, who's this glyphosate enthusiast, he's talking about glyphosate, and he made the point that no other chemical works better for eradicating Japanese knotweed. Glyphosate seeps through the leaves and canes into the rhizome, arresting its growth, and after many applications, forcing it into dormancy. For how long? It's going to come back, obviously. It's a very resilient plant. You can't get rid of it just by spraying glyphosate. Not using anything at all on knotweed, Bose points out, would leave the environment and biodiversity to a far worse fate. In any case, on a sunny day, a spray of glyphosate on a knotweed leaf dries within minutes. He described good spraying weather, dry and still, so the herbicide isn't carried onto the wind, but not too hot, lest it evaporate before being absorbed. So we're dealing with absolute insanity. And this is part of the reason that we're dealing with epidemics of diseases like Lyme disease because of this stupidity. Okay. Here's a very good book in terms of understanding invasive plants. Yeah. And also learning to recognize that the plants that are showing up in your area. So pay attention. What plants are showing up in your area? What might they be suggestive of? Is there a plant that is invasive in your area? Research it. Try and understand what its ecological function might be. Because it's not just there by random. Ecosystems are way more complex and way more intelligent than that. So Japanese knotweed has been used in TCM and in Japanese systems of traditional medicine, and it is um, the Japanese name is Itadori, and it means heals the sick. And it invigorates the chi and the blood. It stops pain. It clears heat and resolves toxins. It transforms phlegm. So it's resolving, it's drying and clearing of pathogenic mucus. So phlegm is a manifestation of underlying organ imbalances, which we see a lot of in Lyme disease. And this action treats both the symptom and the root cause by restoring normal fluid metabolism. And normal fluid metabolism is something very important in Lyme. Hence also the insistence on, working with the lymphatic system. So knotweed has been used to treat arthritis, traumatic injury, jaundice, urinary disorders, constipation, menstrual disorders, kidney stones, burns, hemorrhoids, etc., etc. It also is the plant that contains more resveratrol than any other plant in existence by significant margin. So it's a very powerful medicinal herb and very good herb to get to know. If you don't have it growing around you, do not plant it because it will take over and it is basically impossible to get rid of. So find where it's growing or find someone who's harvested it. And it's also very difficult to harvest. The rhizomes can be larger than my head. I've dug them up before. They are massive. And if you're trying to eradicate it from an area, you won't really have much luck unless you really dig down deep, like with an excavator. Because if you have even the tiniest piece that's left behind, it will survive and it will then continue spreading everywhere. Um, okay, and so Japanese knotweed from the homeopathic perspective, um, it's in the Polygonaceae family, and very interestingly, there's a lot of interesting correlates that we see in this family, not only with this particular remedy, but with the whole family. The basic feeling is that of being a cripple. They can't do what they want. They feel broken, lame, handicapped. That is often the feeling of people that are dealing with Lyme. They have that sensation. They try and find many ways to circumvent their limitations, a feeling of desperation, helping tools to overcome their handicap, the central emotion being uncovered, unprotected, naked. This feeling of being exposed definitely is very strong in people that are dealing with Lyme. They can be over asking, manipulating, over asked, used, and abused. Also, things that Lyme sufferers may experience. We also see the sensation of being crippled, broken, fragile, handicapped, weakness of the limbs, difficult to stand on their own legs, leg problems, weakness, inflammations, arthritis, lots of skin symptoms as well, lots of digestive issues also that we might see in Lyme disease, respiratory issues, and we might see also in Lyme disease if Borrelia start to colonize the lungs. Um, Polygonaceae from the perspective of Macalia Kier, changing and unstable symptoms, also highly characteristic of Lyme. Changeable mood swings, also highly characteristic of Lyme. Confusion and lack of focus, irritability, confusion of the mind, difficult to concentrate, aversion to studying, restless, joint problems. Okay, and that's related to the oxalic acid, high oxalic acid content of plants in this order. And as we saw earlier, there is a relation with oxalic acid and some perturbation to the terrain that can happen with borrelial infections. So there was a proving of Japanese knotweed as a homeopathic remedy and from Colin Griffith. And we see a few things here that are very relevant. Problems that seem hidden from view. Okay, Lyme disease. Fast developing cancers of the blood, lymph, gland, or bony tissue, malignant pathology that is infiltrating, insidious, and gradually debilitating. That says Lyme disease, doesn't it? Cases calling for blood cleansing and lymphatic drainage, depletion and weakness that are gradual and lead to eventual breakdown, weak kidney energy and poor kidney function, dehydration, a sense of profound heaviness, radiation toxicity, chilliness, pains of arthritis and rheumatism. tenseness and drawing and pulling sensations in the muscles and the limbs, as if there were an electric current coursing through. That can also be highly characteristic of Lyme. Pathology of the nervous system, breakdown of synaptic connections. It may be of service in restoring neural pathways, inherited tendencies to conditions that threaten the breakdown of systems, learning difficulties, ability to focus on what is said and instructions, inability to formulate in words what one wants to say can be very characteristic of Lyme. Mind feels blank, vacant feeling. I've seen this in many Lyme patients. Feelings of being disconnected from reality, from other people, from one's usual routines, absent-mindedness and confusion, a sense of lack of flow in life, no trust in the self, poor self-esteem, dementia. All of these are potentially highly characteristic of Lyme disease. So very, very important medicine. And lastly, I just wanted to show teasel. This is something that can be used homeopathically. It can be used in herbal doses, but you have to dose it carefully. It's a very powerful herb. But look here. I mean, look at the tick embedded in the skin and look at the herb. I mean, uh, you know, say what you want about the doctrine of signatures, but from my perspective, it's true. So we see here a powerful illustration of the doctrine of signatures. And so since the time, at least of Hildegard von Bingen, the great visionary mystic, Teasel has been recognized as a remedy that drives poisons from the body. Yulia Graves asks if the outward gesture of the spines in all thistle plants, blessed thistle, milk thistle, teasel, can be taken as a signature for expelling poisons. The Lyme spirochetes burrow into the cartilage where the white blood cells aren't able to reach. Teasel is a remedy that drives the spiral-shaped spirochetes out, thus allowing the immune system to do its work on this pernicious bacteria. Great herbalist Matthew Wood says that the name Teasel means to repair what is broken. That's literally what the name of the herb means. And according to Chinese medicine, this herb strengthens the kidney essence and the liver blood, and Lyme being a catastrophic injury to the muscular skeletal system equivalent to the level of the kidney essence or affecting the genetic material makes teasel potentially a very appropriate herb. In some patients, teasel works very well. In some patients, it doesn't work at all. So it's one herb to know about, to read about. Wolf Dieter Storl's book on Lyme disease, which I referenced earlier, talks about teasel quite a bit, and there's some information as in Buhner as well. As a homeopathic remedy, it's not as well known, though there was a proving also, I think, by Colin Griffith and his group. Unfortunately, it hasn't been published yet, but it's a good herb to know. And, if, for example, you try taking it in the herbal dosage and it's too strong because it is a very strong herb, but you're noticing that it is having positive effects, it can always be used in low homeopathic potencies on herbal indications. And there are animal remedies. So there are a lot of very, very interesting animal remedies. I'm going to be doing a course, which we'll talk about in a second, in September on Lyme disease. It will be 6-hour course, and we'll do a deep dive, and we'll look at cases, and we'll look at these very interesting animal remedies. So there's a few different deer remedies that we use in homeopathy, and they can be highly relevant in Lyme. Deers are one of the main vectors for transmitting ticks that are carrying Lyme disease. This is the a blue fence lizard, which has a natural immunity to Lyme disease, and it's being studied and has been used actually in the herbal medicine community. It's not a herb, obviously, but Matthew Wood introduced it as a tincture and has some very interesting cases, and we'll look at that medicine in detail in the course. And then, of course, we have also the tick itself. We have mice. We have mouse as a remedy in homeopathy, which can also be very important. And we have nosodes like the Borrelia nosode, which is absolutely invaluable in some Lyme cases. You shouldn't just go taking Borrelia nosode. It might make your situation worse if it's not well indicated. Often it will come after a well indicated remedy, usually not as the first remedy in a chronic Lyme case. And I wouldn't say it's a remedy to take right after a tick bite necessarily. We also can see the use of imponderables and think of this electric sensation that we were talking about in Lyme. Um, Imponderable remedies can be very useful, and we will talk about them in the course. There's a huge materia medica to cover, very interesting cases, and lots of other important details that are to be considered. So here is the course information, and we'll put a link. I'll put a link in the chat if you'd like to. If you'd like to sign up, and yeah, subscribers paid subscribers to Canadians for Homeopathy, I'm offering 15% off of the course. So more information on that. And yeah, so please subscribe to Canadians for Homeopathy. If you are curious about Lyme, want to learn more, want to go into a deep dive on the topic, then join me in September and we'll explore in a lot more detail because there's so much to explore, so much to learn about this topic from both homeopathic and herbal perspectives and things you can do. So the course is not just for practitioners, not just for homeopaths. Um, it will be also relevant to home prescribers if you're really passionate about learning and really passionate about understanding Lyme disease. It's suitable for both homeopaths, herbalists, naturopaths, and anyone who wants to understand Lyme disease in detail. So patients who are suffering from chronic Lyme, I think it would also be very valuable and very useful. So yeah, if you have any questions about that, then we can certainly discuss, or you can send me an email. And here's my contact info. And now we can have some questions.
Perfect. Thank you so much, Victor. We're going to I'm just going to bring up my slides again and give a quick thank you uh, to our sponsors. We truly wouldn't be here without the support of Boiron Jackson's, Biolorenco, Herbasante, Schmidt Nagel, Orange Naturals, Remedis, and the Canadian Coalition for Homeopathy. We are grateful to all of our sponsors, and we are very grateful to you for being here, for supporting us, for your enthusiasm, for your attendance. This is why we do it. If no one attended our webinars, we probably wouldn't do them anymore. So we're really, really glad and grateful you're here. And thank you to our subscribers. As I think I put in the chat, but it was so engaging. Maybe not everyone didn't see it, but on our website, there's lots of information about becoming a subscriber. We rely on our subscribers. We are a non-for-profit organization. We are volunteer driven, and there are significant costs to having a Zoom account, hosting a website, accounting. We have to file, every year to, just all these sorts of things, and it adds up. And we just want to gift people with as much great knowledge about homeopathy as we can and how to use it and source it in Canada. And we love that we have an international audience for the information, but we do have these costs. So subscribership goes a long way. $6 a month or $60 a year, which is just $5 a month. And you get lots of perks, including access to our entire webinar library, which is over 50 webinars now, available on demand at any time for our subscribers. Lots of wonderful topics. You've 15% off Victor's course for our paid subscribers, upcoming course on Lyme, which is wonderful. Victor's going to put a link in the chat for more information about it. And we have 15% off Boiron products and some discounts on other courses and other perks. So please consider joining us as a subscriber. And if that's not for you, just keep showing up to our webinars. We love it. Subscribe to our newsletter. Check out our website. For those of you who are paid subscribers and do want to take advantage of Victor's generous offer of 15% off his course, you will be receiving an email from Canadians for Homeopathy. Will be going out to all our paid subscribers who we have email addresses for with the discount code. Look for that in about the next week or two. And you can always email us directly also. If you are a subscriber and haven't given us your email address, you can email us and we'll hook you up. So if you are curious about homeopathy or want to stay informed, our web newsletter is a great place to be. We try and keep you informed of what's going on with homeopathy in Canada, and we also pay attention to our social media, Instagram and Facebook. We're active on. We thank you again for being here. And we're going to have a July and August off, but in September we are starting back on September 21st with Haruta Batista. Talking all about tissue salts for back to school, supporting immunity and beyond. So more details about this webinar will be coming in one of our newsletters later this summer, and pay attention to our website. Will pop up more more details in the sign up link in the next week or so. And as always, the webinars are free to attend live for anyone. So thank you all for being here. And we will pop over to the Q&A now. Um, thank you, everyone. It is just, oh, we've got some lovely comments. Lovely comments going on and people wanting to subscribe and join us, and we really appreciate it. Um, and lots of wonderful compliments, Victor. Wow, this and it really was a really. It sounds like one of the themes in the comments here, Victor, is fears have been allayed, which was, like you said, one of the things. So yeah, less fear and more healing, right? Isn't that a great mantra? So into the Q&A here, we've got quite a few, so we're just gonna kind of dive in. I think you would, some of them, I think some of you have asked questions that were addressed later in the webinar. You may have asked them earlier. So someone asked how the Lyme no-sode is used. I think you kind of addressed that it, if indicated it's, but is there any other comments you'd like to make on that?
Um, yeah, so the Lyme nosode, you can join the course. It's a very important remedy, and there's a lot I have to say about it. I have some good cases of it, but I think the discussion of it, I think I want to save to the course because it's a complex remedy, and often it will be indicated, as I said, after a remedy has already been given that is dealing with, say, the essence of the disease, and then there's a no-sodal layer that is on top of it. Um, what we see is that with that remedy, there can be one of the main indications you can see that I've seen in cases is very strong aggravation with the full moon, and it has to do again with this lunar cycle of the Borrelia bacterials of the Borrelia bacteria, where they have a cycle of aggravation and then calming down. So it can be very, very intense lunar cycle aggravations. There can be this feeling of numerous symptoms in all systems and a feeling of always struggling with illness, very low vitality, weakness of the legs. Um, there can be lots of allergic type of reactions, lots of sensitivity, environmental sensitivities, which you can see in Lyme disease. A lot of issues with memory. There can be very deep, even suicidal, depressive states. Those are some important indications for the nosode, but there's a lot more to say about it, and definitely an important remedy, not only in Lyme disease actually, but for many other different issues.
Wonderful. Complicated, right? The use of no-sodes is often quite complicated. So it
Yeah,
sounds like your course is really going to cover this question nicely.
definitely.
Another question, there's some specifics about a specific case, and I know we can't get into advice for specific people here, but the general, if we take the generalities from this question, I think it's relevant, which is that if someone was on long-term antibiotics after being diagnosed with Lyme or having symptoms from a tick bite, does that, affect the future and treatment and those sorts of things?
Yeah, definitely. It definitely does. Um, as that quote from the beginning emphasized, that antibiotics might make the situation worse. Now, I'm not here to try and scare anybody. Yeah, because there are real solutions that you can find to these problems. And, just taking antibiotics every time you have a tick bite, first of all it's going to do is it's going to increase the spread of antibiotic resistant bacteria in the environment, which is the last thing that we need. Yeah. And especially if you're not dealing with any visible signs or symptoms or any problems, then taking antibiotics is all it's going to do is weaken your organism. It's not going to help you in any way. And so if you get bitten by a tick, I wouldn't just go and jump and take antibiotics. It's not going to help in the long term for most people. Now, there are some cases where, yes, a person is bitten by a tick, they develop a bullseye rash, which again only appears in percentage of cases. Um, but so say all the signs are there and they take antibiotics and then they feel great and everything is fine for a little while. But what can happen in such a situation is that there is basically a temporary amelioration and you've killed off, say, I don't know, 98% of the bacteria. The other 2% are still there. They are very intelligent. They quickly develop a adaptive strategy to overcome the antibiotic that they've been exposed to, and they start proliferating, and they're completely resistant to any future antibiotics you might try and give. And because you've already decimated your microbiome through the use of antibiotics, you're now much more susceptible to this raging infection that you have inside of your body, and it becomes more difficult and more complicated. So it's not my go-to strategy for treating Lyme, and um, I don't think it's really responsible for mainstream physicians to be just handing out antibiotics like candy. Just because you've been bitten by a tick, it doesn't mean that you should be on antibiotics. And it's actually it's throwing fuel onto the fire. So if you take antibiotics and you feel fine and everything is good, I would monitor how you feel. Like that's the best, course of action. And if there are symptoms that start to reemerge, or things that you might think are related to Lyme, say months or even a year or later after the antibiotics, then it's good to keep in mind and to seek out treatment if necessary. Yeah, but it wouldn't be my go-to, and it's not a guarantee by any means that because you've taken antibiotics that you're free of the disease or the infection if it is present. And now many people will be bitten by lots of ticks and never develop Lyme because that is again a question of it's not just like you're bitten by a tick, therefore you have a infection. It doesn't work like that. It's not so linear or simplistic. There's many complex factors like we discussed that will determine whether or not a person comes down with Lyme or any of its many co-infections.
Fabulous. Thank you, Victor. And that, yeah, I think you've answered just in that some other questions about, should one always be concerned with every tick bite and that. So thank you. Someone has asked on the misconception that you can only get a Lyme infection after a tick's been attached for 24 hours. Their question is, have there been cases where a tick was found on someone and the tick was tested and found to be a carrier of Lyme, but the person never had any symptoms at all?
Oh, for sure.
Yeah.
Yeah, for sure.
Okay.
Definitely.
Okay. And then what does that mean? They were wondering if you had any thoughts on if that means the bacteria didn't transmit, it was the terrain was of the person was strong, or any other thoughts.
Yeah, usually it's because the immune defenses are strong enough to ward off any infection. And so that's why, doing prophylactic treatment like with astragalus and cordyceps and those other herbs that were discussed can be very important because you're basically priming the immune defenses so that if you do find a tick and it is carrying, say, Borrelia, that there's the susceptibility is removed. Yeah, so that's the best strategy is actually maintaining um, high level of defensive reaction inside of your own body so that you lessen your susceptibility towards these pathogens.
Yeah. Robust health is your best defense always, right?
Yes.
Um, a couple questions have come up about the herbal preparations.
Mhm.
Someone's wondering if there's a risk of toxicity when taking Scutellaria long term.
Mm, well, I mean, you should, if you're going to be taking any herbs, you should read about them and understand them and how they work first. Yeah, don't just go and take a herb just because you heard about it. Um, but and dose according to what is required for you. So some patients will require minuscule doses of herbs. Some patients will require massive doses of herbs, depending on their sensitivity, depending on the nature of the condition that they're trying to treat. Um, and so some herbs that may just totally throw some patients completely out of whack, like teasel is one herb that we spoke about that might do that. For other patients, they're completely fine and they take mega doses of these herbs and it is really deeply curative and doesn't cause any issues. So toxicity, I would say in general, most herbs have a very low toxicity profile. Yeah, Scutellaria, I've definitely had patients on Chinese skullcap long term without any problems, but then, they're being supervised and, dosing is according to their needs. And so you have to understand your own levels of sensitivity if you're treating yourself. And Stephen Buhner's book in terms of herbal protocol is the best. He gives very detailed protocols for working with symptoms on your own. If it's something that you want to do, I don't necessarily recommend it, but it is possible, depending on how intense the disease is and how much you're invested in learning, because it's not something that is straightforward. Lyme treatment is very complicated in most cases. And so while it is possible to treat at home, by yourself, you have to put in a lot of hours of research and understanding the symptoms and understanding herbs and remedies that might be useful based on what's going on. So there are cases of people treating chronic Lyme conditions by themselves using Buhner's protocols with a lot of success. So, um, but yeah, in terms of dosing herbs, it's very individual, and it's good to have foundational knowledge in terms of understanding your own patterns of reactivity to different herbs.
Okay. Fabulous. Yeah, everyone's unique, right? And the guidance of a trained professional would be probably really helpful in these cases. Another question about the herbal aspect. Are the herbs you mentioned besides astragalus okay to give chronic Lyme patients or those with mast cell activation syndrome?
uh, if it fits the case. Yeah,
Yeah.
if it fits the case. I mean, because yeah, you have to individualize. There are lots of herbs that can be potentially useful. There are lots of homeopathic remedies that can be potentially useful. And yeah, if you're dealing with something like mast cell or complex autoimmune issues or immune dysregulation, then you have to be very careful because yeah, you can easily throw yourself into a flare and then have symptoms that are much worse and may linger for weeks or even months because you're taking, dosages that are way too high or remedies that are contraindicated, and then you can run into problems. So if you're going to try and tackle this, you have to really be very clear about what you're doing and really know what you're doing and dedicate yourself to learning how to treat yourself properly.
Fantastic. Um, Someone is wondering if you could just refresh the resources on self-lymphatic drainage.
Yeah, it's called Doc Tox Detox. I'll put it in the chat. Okay. Doc
Perfect.
Tox Detox. And you want to look at specific 7. Okay. And I'll just put it in the chat. Yeah, really, really good resource. Uh, like I started doing lymphatic drainage. I'll just give my own account. I started doing lymphatic drainage just because it was recommended by my yoga teacher. I did a course with her on lymphatic drainage, and I had a chronic problem with my ear. It felt like there was a plug in my ear all the time. Like I thought I had hearing loss, and there was like this plug. It's so annoying. And I've been through years of homeopathic treatment, herbal treatment, osteopathy. Nothing really helped it. I started doing lymphatic drainage, and after literally 2 days, I felt all this fluid draining from my head for like 2 weeks. There was a cascade of fluid just draining from my head, and that block is gone. Nothing, and I mean nothing, helped with that issue before. So it's remarkable. It's very powerful. Yeah. And really, many people are unaware that you can do lymphatic drainage at home every day by yourself. And you can, and it's very easy. It's very straightforward. It takes like 5 minutes a day. And the results are very profound. So I highly recommend experimenting with it, trying it out.
They can be. And it's
Yeah.
there's actually it's very popular for cosmetic promotion,
Yes.
like on social media lately. So yeah, yeah. So
Yeah.
Doc Talks Detox, great to have a good resource. Thank you. Um, yeah. And someone is wondering if you have any cases you'd be interested in sharing, any that you've had success with.
Yeah, I have a number of
Lyme.
cases. I have
Yeah.
a number of cases. I was contemplating, sharing some cases. Okay, one short one. Basically, let me just pull up a photo here. Okay, 1 second. Okay. All right. So this is just a very short case. So this was you can see this photo.
Yeah.
Yeah, this was a patient who was bitten by probably a tick. Yeah, he wasn't 100% sure, but he had massive, massive, massive swelling on the knee, and he basically couldn't walk. And so, yeah, what do you do? And it was very painful. He couldn't walk, and so I gave him actually a constitutional homeopathic remedy, which is a damselfly, which he'd been taking long term for different issues. So he was taking a constitutional remedy, and then I gave him Simicifuga, black cohosh, Japanese knotweed, and andrographis as herbs. and this completely cleared up with the herbs and occasional doses of his constitutional remedy. But those herbs were prescribed on the indications of the symptoms that he was experiencing, the nature of the joint pains and the paralysis of the knee. And black cohosh can be a very useful herb in these kinds of septic kind of looking conditions. So it's a snake medicine, yeah. And you look at Simicifuga, it's basically it's a snake root. So it was used historically for sepsis, for snake bites, for these kinds of things, and definitely is one of the herbs that we might consider in uh, post tick bites as well. If it's a kind of presentation like this with lots of joint involvement and joint pain, and yeah, it cleared up like within a couple of days. Swelling completely disappeared. It was actually getting worse and worse and worse, and it was spreading more and more. He started on those three herbs, and it was clear. It was good. Yeah, so that's a very quick case. Yeah, but there's other more complex cases. So like treating these things early is much easier than treating late stage chronic Lyme. It becomes more difficult, more complicated, more involved, more complex, more layers. But if you have like symptoms like that, indications like that, can be really fast and really easy to treat. Yeah, and from my experience, much more effective than antibiotics.
Yeah.
So, yeah,
Yeah.
that's a short case. There are other cases that are more complex that we'll look at in the course. There's very interesting cases that I have of Lyme disease and some unusual remedies that you wouldn't necessarily associate with Lyme. So,
Yeah. Okay. Fabulous. Someone is wondering if you're familiar with the recommendation to use Mediterranean rock rose, Cistus incanis, as part of a preventive protocol. I'm assuming they're talking about homeopathy, but it could be herbal. They were, you'd heard of
no,
that.
I'm
No.
not.
Okay.
No.
Okay. Um,
There's lots of herbs. There's lots of herbs and lots of remedies that can be used for Lyme. So even like you read Buhner's book, which I recommend that anybody interested in Lyme reads, you'll see that he says like we cover lots of herbs in this book, but they're not the only herbs that can be useful in Lyme. These are some of the herbs that we know are useful,
right.
and there's many others that are potentially useful. It's not like a set in stone protocol, especially when we consider that these diseases are evolving, they're not static.
Yeah.
So if we're dealing with an evolving disease, we have to work with evolving treatment strategies as well.
That's well said. Well said. Yeah.
Yeah.
Can't approach evolving with static.
Yeah.
Um, Someone is wondering what the best means to diagnose Lyme is. You mentioned how challenging it is to diagnose, with
Yeah.
conventional medical tests. So,
Yeah. There's no good testing, and I don't think there's going to be anytime soon. Yeah,
yeah.
it doesn't exist. You can read in Buhner, he recommends like five or six different tests all done at the same time and looking at them, reading them all together, and comparing the results. And that maybe will give some better clue. But usually if you are working with a practitioner who's literate in understanding Lyme disease and its myriad presentations, that's the best means of understanding it's an unofficial diagnosis, but
Yeah.
it's really the best that we have is working with somebody who really knows what Lyme disease can look like. And there are distinctive patterns that you can look for and that you can understand.
Yeah. Amazing.
But I
And
no none of the tests are reliable. Yeah.
yeah, thank you. We I love our lively chat that's always filled with good information. Someone was from Bridget, I can't remember where you said you were from, but it used cistus tea to her dogs because in Greece they noticed sheep who were eating the cistus plants did not have any ticks. So there's maybe an answer for the person who was wondering about cistus as a preventive. So that there maybe is some, that's kind of a cool anecdote. Neat.
Yeah.
Um, okay. Um, uh, Someone was asking, and you kind of addressed it earlier with the antibiotics. So just to it's a little bit of a twist on the same one that there are people who have been diagnosed with Lyme and given antibiotics for over a year. How do you approach as a homeopath a case like that, because it is become so complicated with all the antibiotics on there. Is
Yeah.
has it been sort of its own new disease created is the way this person worded it.
Yeah, that very well could be the case.
Mm,
Antibiotics for a year is so extreme. I mean, that's a problem.
mm,
Yeah, it's nothing. The antibiotics are nothing to take lightly, and they can cause a lot of problems for people. So, I think it's underestimated just how significant antibiotics can be. I mean, I've seen patients that have taken a single dose of certain antibiotics and have ended up in the emergency room for
mm.
various reasons. Yeah, it's not like not to say that, and there's many different types of antibiotic. Yeah, some are more dangerous than others, but um, antibiotics for a year. Well, the thing to do is to take the case and to you know, in a situation like that, there's no one answer. You just have to take the case, do a really thorough job of understanding what actually needs to be cured and approaching it on an individual level because it's highly complex. You can, possibly consider doing clears like antibiotic clearing protocols exist. Personally, I've done these different clears with patients for different kinds of drugs and inoculations and so on. And in some cases, they can be highly effective, but usually after that, there still is more work that needs to be done. And I don't really find them to be a definitive treatment strategy for anything. It can help to shift the train a little bit, especially if there's been like long-term use of a drug. That in those cases, they become more relevant. Yeah, like so for years and years and years, you've been on such and such a drug. Then the clears can be, and say other remedies, well-indicated remedies, are not having a deep effect. Then you can do a kind of clearance or detox protocol using homeopathic version of the drug in question. That can be very effective in some cases, but as just a simple go-to, I don't see it as that. It's for cases where there's a block or where patient is not improving in ways that you'd like to see, or there's some issue that just seems stuck, and it might be related to the long-term exposure of a certain drug that the person has been on. Then I think there's good indications for doing a detox, a homeopathic detox. And that is one potential strategy. But if there are other symptoms that are clearly pointing to a remedy, I would always start with trying to find a good remedy first.
Yeah. And I think this is one of those cases where you find a professional homeopath, right? If someone's been on antibiotics for a year and has Lyme,
Yeah.
that is definitely time to, you know, yeah. And we have some homeopaths on the call and lots of home users so yeah, but that's time to find a professional. Um,
Mhm.
Not a homeopathic question, but do you know of any natural or homemade bug sprays that are helpful in protecting from
That's a good point. Yeah. Uh, lemon eucalyptus is very good.
Okay.
Yeah, lemon eucalyptus is definitely um, really good tick repellent. And um, yeah, that's the one that I would use personally. I'm sure there are others, but lemon eucalyptus definitely
Yeah.
is high up there. Yeah.
Okay. Wonderful. Wonderful. Um, someone is asking if someone comes in with to your practice with Lyme and a set of labs, do the details of the strain on those labs inform what you do?
Um, Possibly. It depends. Yeah.
Yeah.
Especially if you're using herbs with homeopathic remedies, it's perhaps not as relevant because you're treating the person always. Um, and so with herbs, it can make an impact. It can make a difference. But then again, the tests are not definitive.
Mhm.
So you take these tests with a grain of salt because there are a lot of false positives, there are a lot of false negatives. The testing is unreliable, and for many reasons, and you can read about it in Buhner's work, it's very unlikely that we will ever in the foreseeable future have reliable tests for Lyme and its co-infections.
That's right. Okay. And lots of questions about testing for us. I think you've done a great job of answering it. Someone just sort of said, why can vets do an effective blood test for diseases encountered through a tick, but not for people? But I'm unfamiliar with that. I don't know if you know much about that territory. I don't know.
No,
No.
I don't
Yeah.
know. I don't know that the tests that the vets are using are
Yeah.
very
Yeah.
effective either.
And okay. Um, Someone is wondering if you have any thoughts about using syphilitic, I'm assuming they mean syphilitic miasm remedies. I'm assuming that the homeopath Ewald Stodler speaks of using Mercurius solubilis in LM potencies when a rash after a bite appears, and other syphilitic miasm remedies. Um, and they're wondering if what your thoughts are on that.
Um, they wouldn't be my go-to personally if I was bitten by a tick, and I had reason to be concerned about it. I would be taking Astragalus, um, Cordyceps, Japanese knotweed, these herbs. I would do the Andrographis poultice, and I would probably take a few doses of Calluna vulgaris, the remedy that I mentioned. That would be my strategy, for myself personally, because I know my constitution. I know what I respond well to. Um, Merc Soul, I wouldn't see it as necessarily a remedy to take after a tick bite personally. I don't really see the indications. The remedies in the Ericaceae family, I think, have much stronger indications. Um, yeah, certainly there is a relationship between Borrelia and syphilis, but it's a different miasm. Yeah, there is Borrelia miasm, I would say. And Luke Klein makes a very good and compelling argument for the existence of a Borrelia miasm, Lyme disease miasm. So
Mhm.
while they're related, you can't just use necessarily anti-syphilitic remedies automatically in Lyme cases. And you look at a remedy like manganum, for example, that might be a very well indicated remedy after tick bites, depending on the constitution, depending on, also like say for example, you have done well historically with plant remedies. And you've been treated primarily with plant remedies, then probably a plant remedy would make more sense for you to take than a no-sode or a mineral remedy. If you've done really well historically with mineral remedies, then probably a mineral remedy would be better for you to take after a tick bite. Depends on your own pattern, your own susceptibility. And some people really respond well to certain groups of remedies and don't respond well to others. So that's also something important to keep in mind that even the recommendations that I'm showing here, like these are remedies that may work really well for some people and may have no effect at all for others, which is why I think having a multi-pronged strategy after a tick bite is very important because I wouldn't just hang my hat on one thing working necessarily. It would take a very complex approach for a potentially complex problem.
Wonderful. This is a question for me. What's the green clay that you were mixed with
Oh,
astrology?
just any kind of green clay. Like
Okay.
I don't
Okay.
think it has any other specific name.
Okay,
Like
it's just called green
yeah,
clay. Okay, I hadn't
green
actually
clay.
heard
Yeah,
that.
like if you look up, like people use it for cosmetic purposes, but yeah, if you
Okay.
just
Okay.
yeah. But it's a drying agent, so it helps also to assist the andrographis to draw the infection out.
Infection out. Fabulous.
Yeah.
And I think we've done a good job of going through the questions for the most part. And the last one is, what do you find the success is in resolving the symptoms, the debilitating symptoms of Lyme and restoring to health with the homeopathic and herbal approaches?
Very good, very high.
Okay.
Yeah,
Well,
yeah.
that's one.
I don't think I've had a failed case.
Okay.
Yeah.
Amazing.
Yeah,
Isn't
so
that
it's very good.
hopeful?
It can take a long time. I mean, like I would say, especially if it's like late stage Lyme and very intense, like probably at least a year of consistent treatment because it's not going to go away overnight. And I understand. I mean, look, it's a serious issue and can be very debilitating, and there is this kind of despondency and hopelessness that can come as part of the condition. But if you stick with a good practitioner who knows how to work with Lyme, then you can most likely get better. It's not a death sentence. And you can read Buhner's book and see all kinds of miraculous examples of people that have gotten better. You can read also anecdotes, people online who've used even Buhner's protocol by themselves, treating themselves at home, being very diligent students of how to navigate things as they come up, and basically being entering remission and staying there indefinitely. So it's totally possible. It takes depending on like this short example that I showed of the guy that was bitten by probably a tick and had this big reaction. It cleared in a couple of days. So Had he gone on antibiotics, to be honest, I don't know it would have done anything in his case, knowing his history. And it probably would have made the situation worse. But in a couple of days he was basically better. He stayed on the herbs for about a month because that's usually what I think is a good idea to do after a tick bite, especially if you've had a bad reaction. But he's been perfectly fine. All those issues went away. And then I've had other cases that have been, people who are in remission and then they're in remission and the symptoms just flare up and they're worse than they ever were before. And then they come for treatment. And then over the course of 6 months to a year, things really, really, really calm down. So I've seen it enough times. And yeah, really good work can be done with Lyme.
Amazing. Well, on that incredibly positive note, I think, we have kind of a never-ending flow of questions coming in, but I think that's a really great positive note to end on. And thank you, everyone, for staying with us for an hour and 45 minutes for this amazing and educational presentation. Victor's, again, and we put it in the chat a few times, but it's victorchirone.com. And you can find him there, find out more about his course. And I think, probably just email you, Victor, if they have questions about your course or talking to you as a practitioner if you're accepting new patients for working with you. So thank you everyone and thanks for your support. Have a wonderful summer. We're taking a 2-month break at Canadians for Homeopathy, but we will be back with bells on in September. Have a wonderful summer and thank you all so much for being here. Have a great evening. Bye for now.